I am Professor Tariq Wasim, and you are watching our Facebook and YouTube channel, Medicine by Professor Tariq Wasim. And today we are going to talk about how do you prepare yourself to examine a patient, how do you approach, how do you dress up, and what necessary tools you have to carry with you to examine a patient, whether you are examining this patient as a medical student in your wards or on your clinical rounds, or whether you are examining them as a physician or as a resident in your clinical chambers or in your outpatient departments. You have to have the necessary equipment with you. So we'll be talking about how you get ready to examine a patient. The first and foremost is how do you dress up? It's customary to dress up, wear say lab coat or what we call an overall. There has been talk about that these overalls should not be used in hospital setting while on working because they have been labeled as a source of transmission of infection from one patient to another. So there are certain places where these overalls are not recommended or are not permitted to be worn while working or taking care of your patients. But still, in most part of the world, this identifies you as a doctor. This, in fact, when wearing overall, the kind of respect you get from your the attendants and from patients, that's definitely there. You must carry your name tag. You must carry that so that you can be identified that you are so and so and what is your position in their medical care team. But having said that, as since they are being considered that they may not be one source of transmitting infection, so they have been replaced by certain newer so-called theater kits or newer kits where you have half sleeves and you can wear them while working or examining your patients in your clinics. And along with that, it's equally important to safeguard yourself and your patients. So having these gloves and face masks, particularly after this COVID pandemic and so many other communicable diseases, you never know that the patient you are going to examine may be carrying an infection and that infection may be transmissible or communicable. So it's better to protect, but routinely while in your clinic or in an outpatient setting, you usually don't use these uh, face masks because that hinders the free communication with your patients. But having gloves, wearing gloves while examining your patient is always advisable. You must carry with you a good clinical method book. I usually recommend Hutchison's. There is another one which my favorite, the Chamberlain's, then McLeod. So you must have a standard clinical examination book, and you must carry a notebook with you, and where to you just take the notes while taking your history or while some important findings you want to note down. So that must always be carried with you. This is definitely a necessary tool with a doctor, and that's how the doctors are usually identified. As I said, overall, maybe worn by other personnel working in the laboratory or other departments. But when you carry a stethoscope, that usually identifies you as a medical professional, either from medicine or allied health sciences. Carrying your own sphygmomanometer is always useful. Uh, Most of the time, when we are, say, asking students to present their histories, they present history and then they just mention BP, blood pressure. Sir, I couldn't find a blood BP apparatus, it was busy somewhere else. So it's always better to have it your own BP apparatus or sphygmomanometer always with you. Then you must carry a thermometer. You should carry a say torch, and not to forget that the torch must carry have its batteries, active batteries in it, because most of the time you find a torch but it is not lighting up because there is possibly batteries are gone or there is no battery in it. Having this tongue depressors for throat examination is always advisable. They may be readily available in the ward, but if you carry your own in your toolbox or in your kit or say box, it's always is useful and helps you. We usually are not in habit of recording patients' weight and height, but it is very important that and that you make it a habit from the very beginning that you must record your patient's weight, height, calculate its BMI, and at least you must carry say simple measuring tape. You would require it a lot of times while you are say, measuring the chest or measuring the abdominal girth, or when you are measuring certain swelling or any wound on the patient's body. You note its dimensions by having its measurement by using this measuring tape or maybe a small foot ruler. The examination of neurological system or nervous system is always there, and for that you have to have a percussion hammer. This type of there is the one with the long handle with the flexible handle, and the one with the steel hammer, and I usually prefer this because it not only functions as a hammer, but it does have a brush with which you can check your the soft touch, and then it has say needle, not very sharp needle, with which you check for the pain and prick sensations of your patients. Uh, Carrying a tuning fork for the vibration sensation checking and performing the Renes and Weber's test in ENT examination is always needed. Uh, Say the Snell chart or a smaller version of that for checking your patient's visual acuity is always should be in your box. Carrying a few of the cotton buds again, if you don't have this type of hammer for checking the soft touch, and this toothpicks, they function to check for the pain sensations or pain prick sensations. If you want to say spend some money and you have say interested, you must get a ophthalmoscope, and sometime since it's relatively an expensive tool, so for medical student it may not be advisable to buy each and everyone buys one ophthalmoscope. You can share it, and you can ask for it, and it usually would be there in your on the nursing station with the other ward equipments, so you can use that when needed to examine the fundus. Similarly, when you require an ear examination, an otoscope may be available on the floor, and you can use that instead of having your own. But if you have your own, that definitely is a plus point. Now you start with this is probably the say slide which I wanted to emphasize upon. We usually are not in habit of say washing our hand before and after examining a patient. So from the very first lesson which we must say convey to our students, to our nurses, to our paramedical staff, that whenever you are approaching your patients, you first must wash your hands properly and then approach the patient. And once you have finished your examination, you must always wash your hands so that you are not say carrier of transmitting infection from patient to patient. And if the facility for hand washing is not readily available, these sanitizers can be used as an alternative. Now, this is just to show that how your performance is assessed. It is not only assessed by your examination, but how you approach, how do you address them, how do you, whether you introduce yourself, whether you explain to them that what you would be doing with them, and whether you are throughout your examination you have been pleasant, cooperative with them, understanding their limitations. They may have some difficulty in sitting or changing the posture, and you should have been helping them in or assisting them in getting better position. So all these, and of course, they let you examine themselves. So you must always uh, seek a permission before starting the examination, and once you are done, completed your examination, you must thank them for allowing you to examine themselves. The physician has to be a great observer. So it's saying that eyes can't see which the mind doesn't know. So you have to have a bit of a knowledge of what you are expecting, and for that you prepare yourself for the examination a day earlier, or you read out about the patient. As I said, the physician has to be a very good observer. So the first general observation you starts with the moment either you enter your patient's examination room, or the patient walks into your examination chamber, or you approach him in the ward or in the clinic. So you notice that how they approach, and their whether they how they are walking, their posture, their dress, their hygiene, and these simple observation would tell you a lot about your patient's overall condition. Sometimes you can make a spot diagnosis by just looking that you have seen a patient with a peculiar rash or a peculiar faces, and you just recognize that that can be there, but only once you, as I said, if you have already known or seen that type of a patient or a case, you would to make that. Now, how do you start? You start with, we always been telling from the very first day that if you are a right-handed person, you always approach your patient from the right side of the bed, stand on the right side of their couch or on the chair if they are sitting, and that makes you easier to maneuver certain, say, clinical methods while you are doing it. Always introduce yourself, that who you are, what is your position in the team. You, as we just gave an example, that I am Mr. So and so, and I am from the medical team, and I have been assigned to take your history and examine you, and then I will be examining, presenting your finding to my consultant, and then we'll discuss your case about your management. Always ask permission to examine. Don't just go and there start say holding his hand without letting him, telling him that what you are going to do with him. Notice their appearance. They may be looking very well, or they may be unwell. They may be in agony. They may be in pain. They may have visible dyspnea. They may have, say, maybe tossing up in the bed with the pain. So all these simple observations would help you in noting the, not only the intensity and severity, but the urgency of the examination. And then of course you may have to modify your examination technique according to your patient's level of comfort or discomfort or ease or disease. Always note their behavior and mood, whether they are in a mood to talk to you and they are cooperative, or they are, say, not very well because of pain or any other discomfort. So that has to be noted down. So whether your patient is very calm and quiet, or is agitated, or is in a distress, or appears depressed, or is apprehensive. So these observations, simple observation, are helpful in further planning your examination. And of course, whether they cooperate with you during the examination, or they are hesitant of examining, because in the end you probably, some of your uh, steps in examination may not be proceeded with because of your patient did not allow that to do, and that of course you would be telling to your examiner. And well, when you're yourself consultant, you probably had to note down those limitations. It's very important that how you position your patient. Your positioning and exposure should be appropriate and adequate. Do not unnecessarily expose the patients. Particularly be careful while exposing females, their abdomen or chest. So it's better to have properly screened the bed or the couch, and preferably it should be done always for examining a female in our part of the world. The female attendant should be close or nearby, so that the patient, uh, female patient particularly, feels comfortable. So your position should be as convenient or as easy as possible as the patient's condition allows. You should expose only the required part. Do not unnecessarily expose the other parts. Explain to your patient that what you would be doing, whether you say are going to check for the reflexes, how they have to position it, when they have to take a breath in or breath out. So proper explanation of the uh, method you are going to do, or how you are going to do it, and explaining them that it would not harm them. Once they you have done with the examination, always thank them for their cooperation. And if you find that it was some you caused some inconvenience to the patient, or some discomfort, always do apologize for that. So there is no specified sequence of examination. You can modify your sequence examination according to the circumstances. Sometimes you may have to examine their say involved part first rather than having general look, but it is customary to start with a general observation of your head to toe, a general scanning of your patients, and noting down, as already mentioned, their appearance, their posture, and any agony or any visible deformities which you can note down. You can also note whether if they are hospitalized patients, or they are whether they are having any IV cannula on their arm or leg, or whether there is any Foley's catheter inserted, or if there is an NG tube in place. So all these things are to be noted and to be mentioned in your notes as well. You start after a general look from head to toe, you start the examination of the hands and the arms, and we'll be talking in detail in our next video about the examination sequence and how the examination is carried out, and we'll be also showing you the video say demonstration of how the examination is conducted. You note down their vital signs: pulse, blood pressure, temperature, and respiratory rate, and you might now add an pulse oximetry using an oxygen saturation, uh, also noting, which has become almost an essential fifth vital sign after the this COVID era. You look at their face, and any peculiar facial appearance that has to be noted down. Then you proceed to examine their head, eyes, ears, nose, and throat, and this is generally abbreviated as HAINT. Then you ask them to open their mouth, and notice their hygiene: mouth, gums, tongue, and the oropharynx is examined. Then you proceed to examine the neck for palpating the lymph nodes, thyroid, and looking down at their neck vessels. And then you move on to examine their axilla for the lymph node, groin for the lymph nodes, and finally you move down to examine their shin and ankle for edema, as well as any deformities in the ankle. So this is the sequence you usually follow. And so in the end, we mentioned about your survival kit in clinics and wards. Always be appropriately dressed, wear a very nicely pressed lab coat, not a very shabby look. You must carry a standard clinical math textbook with you along with your notebook. You should be carrying a double-edged stethoscope, a sphygmomanometer, a thermometer, a pocket torch, a measuring tape, a percussion hammer, some toothpicks and cotton buds for checking the sensations and pin sensations, and of course, you must carry a sanitizer or a hand wash. So today we have prepared you to come to the ward and or to the attend to the outpatient clinics, and the necessary things you must carry with you, how you approach your patients, and how you should start your examination. In the next videos, we'll be talking about general physical examination, starting from the examination of the hands, and then we'll proceed step by step to the whole examination. As in the beginning, we mentioned that this video series is intended for primarily for medical students and those with the very earlier on exposure to medicine, like in third or fourth year. But it is useful for the students of later years, or even for house officer or postgraduate residents as well, because what we as examiners, as educators, find that these things still are overlooked, and they are probably need to be emphasized again and again, that how important it is to carry a certain persona with you and be equipped with the right type of the instruments and tools to examine your patients. Thank you for watching, and if you like it, you spread the word to your fellow students, colleagues, so that they can also be benefited. Thank you.